Hi, I'm here to talk to you about the importance of universal health care. The current problem with healthcare in the United States, some of the issues, many Americans don't have coverage or have less coverage than they need due to the cost of the premiums. Those without health care tend to use the emergency room for services that should be done at a doctor's office, which drives the cost of healthcare up. Our pharmaceutical companies tend to focus more on profit than the actual treatment of patients, which drives the cost of healthcare up, and also the cost of research. Research is expensive. Healthcare per capita, as you can see in the chart, the United States is more than double any other country. The United States spends $10,738 on healthcare. Canada, $4,826, and the average per country for other countries is $5,280. What contributes to healthcare costs? The cost of drugs, overuse of specialists or the emergency room, our aging population, the misuse of the emergency room, and the healthcare premiums that people have to pay to cover those healthcare needs. Some of the pros and cons of a united or universal healthcare. The pros: it lowers healthcare costs. It forces doctors and hospitals to provide the same standard of care at a lower cost. It eliminates administrative costs since there's no private insurance. Some of the cons: longer wait times for treatment of elective procedures. People might overuse the insurance since it doesn't cost them any money. And it forces healthy people to pay for the Medicare or the medical care of sick people. How universal health care can be helpful. With universal health care, if you contract with medical providers to provide the same services at a lower cost, having a preventative care for everyone will help lower costs, because that means that people are getting preventative services so you can catch the illnesses that tend to be high dollar illnesses before they get to that point, and possibly they won't need treatment for those. Working with private health insurance companies to provide coverage other than the emergency coverage that a universal health care typically does, such as your dental, your vision, your hearing, would be a helpful option. Working to control the costs of medications. If they took some of the profit that the companies are making on those medications and put it into the actual care, that could save tons of money. Making sure that patients get the necessary treatment. Having a universal health care where somebody's monitoring the exact services that people are getting, it will prevent the unnecessary testing and treatment that people are obtaining currently. Obama made great strides in this direction by forcing all healthcare plans to provide the exact same essential benefits. It makes it so more people have access to those certain services. Also, what Obama did is he made it possible for you to keep your children on your health plan until they're 26, which gives them the opportunity to find a job that has medical insurance but still be covered during that time. There are a lot of other things that Obama did with his quote-unquote Obamacare that is making great strides to getting health care to everybody that needs it. Thank you for listening.